Are you struggling from back pain? Do you find that standing for long periods of time is challenging, and maybe leaning over, leaning forward, or leaning over on a shopping cart gives you actually some relief? You could be suffering from spinal stenosis. Today, I'm going to teach you about spinal stenosis. I'm going to show you my 5 go-to stretches for anyone who's suffering from spinal stenosis, which can help you feel better. Now, let's understand what lumbar spinal stenosis is. So what is spinal stenosis? Generally, if you think about it, your brain communicates to the whole body through the nervous system. And what happens is your brain sends signals down the spine and out the nerves to the whole body. But what happens in stenosis is that the canal which the spine goes through, that canal has lots of space for the spine to be able to go through, but over time, and many factors can cause this, and I'm going to explain to you what those factors are, but that canal, that tunnel, starts to get narrow, starts to get smaller. Now, it doesn't happen to everybody, but it happens. And when it happens, and that canal gets smaller and smaller, that spinal cord starts to get pressure put upon it. And that pressure builds up. And so when that pressure builds up, wherever those nerves are going to, they're going to be affected. Think about it this way. If you are watering your garden and you've got this garden hose and the water is coming out, and then you go to put your foot on that garden hose, what happens to that water? It slows down. What happens to the water coming behind that foot? It's starting to build up. All that pressure is building up. And so wherever that water is going to that garden, that area of the garden is going to start to break down. It's going to start to deteriorate. It's going to start to die off. And you think about this, this is what's going to happen to your body, because suddenly where that nerve flow is supposed to go to, it's not going, because there's pressure around that spinal cord that is inhibiting that nerve from flowing. And so a lot of people think you're going to get back pain. A lot of people think you're going to get leg pain. You could get pain down the leg, numbness, tingling, all of that, loss of sensation down the leg. But guess what? Those nerves are just not limited to those areas. They can affect your organs. So all these things can start to deteriorate. And so that's important to understand, that lumbar spinal stenosis is just not limited to the spine. It can affect everywhere those nerves are going to reach out to. Every part of that body could start to break down and be affected. So people always ask me, how did this occur? How did I get here? How did I get to this state? Well, there's many different causes. The one most simplest cause we can talk about is arthritis. So arthritis is a factor that a lot of people have, and it could lead to lumbar spinal stenosis. And that means the ligaments, the joints around there are starting to get thicker. The bone that's actually building around that spinal cord is actually getting thicker, and that could affect it. Then you could have things like inflammation. That area could be extremely inflamed. And guess what? Arthritis itself is an inflammatory condition. So that inflammation is now taking up space in that spinal cord, and it's affecting that spinal cord too. Then you talk about bulging discs. Well, think about what a disc is. A disc is a shock absorber. And the best way to describe a disc is that if you look at a disc, the outside of the disc is very, very tough. The inside of the disc is it's like a jelly-like substance. And that jelly-like substance absorbs all the pressure. But your disc can bulge, okay? They can bulge. And that's a normal phenomenon. It's when the bulge gets so big that that disc starts to impact inside the spinal cord. So what happens is, you have this disc, okay, and the disc starts to bulge, as you can see right here, with this little bulge here, okay? So you can see healthy disc coming on right here, the space, but then you see that bulge happening, and that bulge starts to happen, and that starts to impact the nerve, the spinal cord, all of that through there. So when that bulge happens, okay, that bulge, it's kind of like a balloon with water in it, and you squeeze one end of the balloon, the other end starts to bulge. And it's normal for your disc to bulge, but when the bulge is so big that it starts to touch the nerve, the spinal cord, that starts to create your compression. That starts to create that narrowing. That starts to create that stenosis. So then you also talk about bone spurs. Bone spurs is a form of degeneration, degenerative disc disease. And when bone spurs occur, those bone spurs starts to build in that spinal canal, and that starts to impact that spinal cord, as well as can touch the nerves too. And then you talk about another condition called degenerative disc disease. Degenerative disc disease is when the disc starts to collapse, because the disc, which should have a nice structure to it, starts to get thinner. And when that happens and that disc starts to collapse, it starts to affect and impact that spinal cord and that nerve. So all these conditions could start to occur. And if you look at an MRI report, an X-ray, things like that, you may find these things popping up on those areas. And that arthritis, that breakdown, that degeneration, that bone spur, whatever it is, could lead to stenosis. And that's something that we want to talk about in terms of how do we give you relief from stenosis.